Hello learners, welcome to lecture 59. In our previous session, we explored how policy advocacy can shape systemic change in reproductive and child health at national and local levels. Today, we will broaden our perspective to examine global approaches to RCH ethics and advocacy. Across the world, different societies grapple with similar challenges ensuring women's autonomy, protecting children's rights, and reducing health inequalities. By comparing global experiences, we can identify universal principles while also appreciating contextual variations. This lecture will highlight key global frameworks, case studies, and lessons learned from different regions. Global perspectives matter because reproductive and child health challenges are universal. Maternal mortality, child malnutrition, and adolescent health concerns cut across borders. Yet, each country addresses them with its cultural, political, and economic context. Learning from successes and failures in different regions strengthens our strategies at home. It also builds solidarity as global health movements unite diverse actors in pursuit of shared goals. International human rights frameworks provide the foundation for global RCH ethics and advocacy. The Universal Declaration of Human Rights affirms health as a human right. The Convention on the Rights of a Child establishes global standards for child survival, development, and protection. The on Elimination of All Forms of Discrimination Against Women highlights reproductive rights and gender equality. Together, these frameworks shape ethical principles and advocacy worldwide. These agreements give governments a clear duty to act and give advocates a common language to demand change. They help set measurable goals for services like safe delivery, immunization, and protection from violence, and guide laws and budgets. Using these frameworks, we can check progress, expose gaps, and push for fair access for women, children, and marginalized groups in every country. The World Health Organization. It plays a pivotal role in global RCH ethics and advocacy. It develops standards and guidelines for maternal and child health, advocates for equity, and positions reproductive rights within the framework of human rights. WHO also coordinates international advocacy efforts, ensuring countries align with global priorities and commitments. Global advocacy movements have transformed RCH over the last 3 decades. The International Conference on Population and Development in Cairo in 1994 reframed population control into reproductive rights. Every Woman, Every Child, launched in 2010, mobilized governments and civil society to reduce maternal and child mortality. The Sustainable Development Goals currently provide a shared agenda, integrating RCH into global health and equity goals. Despite cultural differences, global consensus exists around certain ethical principles in RCH. Autonomy and informed choice are recognized as central to reproductive rights. Non discrimination and equity guide advocacy for vulnerable groups. The best interests of the child remain a universal principle in all child related health and welfare decisions. These principles are applied in diverse ways, but they form the ethical backbone of RCH globally. In practice, this means clear consent in local language, fair access to services for the poorest and the most remote families, and decisions that always protect a child's safety and well being. Programs should track equity gaps and correct them quickly. Providers need simple protocols to balance autonomy with protection, document decisions transparently, and involve communities respectfully. So these shared principles become everyday practice. Maternal health exemplifies global ethical concerns. Maternal mortality remains unacceptably high in low and middle income countries, raising questions of justice and equity. Advocacy for respectful maternal care emphasizes dignity and freedom from abuse in childbirth. Ethical principles demand universal access to emergency obstetric services regardless of geography or wealth. Child health advocacy has led to strong global commitments. Immunization is recognized as a universal right, with initiatives like Gavi expanding vaccine access. Advocacy against malnutrition has resulted in global nutrition targets. Ending preventable child deaths remains a unifying global goal, demonstrating how advocacy and ethics converge in child health. Globally, adolescent health is gaining recognition as an ethical and advocacy priority. Comprehensive sexuality education is promoted as a human right, equipping adolescents with knowledge and agency. Mental health advocacy highlights the growing burden of depression and anxiety in young people. Addressing gender based vulnerabilities such as early marriage is central to global adolescent health agendas. Latin America provides a vivid example of global advocacy in action. Women's movements have pushed abortion laws reforms, balancing ethical debates on autonomy and cultural values. Countries like Argentina have expanded access despite resistance, while others remain restrictive. This demonstrates the complexity of advancing reproductive rights within different cultural and political contexts. Advocates combine data on maternal morbidity from unsafe abortions with powerful personal stories to make the case for change. Courts, parliaments, and referendums have all been used, showing that legal routes vary by country. Even where laws remain restrictive, harm reduction approaches, post abortion care, contraceptive access, and respectful counseling protect health and dignity. The key lesson for RCH is to pair right based messaging with culturally sensitive dialogue, sustained coalition building, and clear service plans so reforms translate into real equitable care. In Africa, advocacy has focused on reducing maternal mortality through skilled birth attendance and expanded access to emergency obstetric care. Ethical arguments about equity and justice have been central, emphasizing the need to reduce preventable deaths. Countries like Rwanda and Ethiopia have shown progress through innovative advocacy and strong political commitment. These efforts highlight simple but powerful steps. Train and retain midwives, ensures 24/7 referral and transport, and keep blood and essential medicines available. Community leaders and women's groups are engaged to promote respectful maternity care and address cultural barriers. Data dashboards help minimize ministries track where deaths occur and fix gaps quickly. Financing schemes such as community based insurance reduce out of pocket expenditure so rural and poor women can reach care on time. The overall lesson is clear. When advocacy, political will, and reliable services come together, maternal deaths can decline rapidly and fairly. In Europe, advocacy for adolescent rights has centered on sexuality education. Nordic countries exemplify a right based approach, providing comprehensive school based education and adolescent friendly services. Other contexts, however, struggle with balancing adolescent autonomy and parental rights, reflecting the diversity of ethical debates even within high income countries. Advocates emphasize evidence. Like comprehensive sexuality education is linked with delayed sexual debut, higher contraceptive use, and fewer unintended pregnancies. Policies work best when schools, health services, and parents all support confidential, youth friendly care. Because laws on consent and minor decision vary, providers need clear national guidance with simple clinic protocols. Ongoing dialogues with parents, faith groups, and youth councils help tailor curricula to local culture while protecting adolescents' rights and safety. South Asia has been at the forefront of advocacy against child marriage, linking it to poor reproductive and child health outcomes. Campaigns emphasize the connections between health, education, and rights. While advocacy has resulted in stronger laws, enforcement remains a challenge due to entrenched cultural practices, highlighting the gap between policy and reality. Effective strategies pair legal reform with community dialogue, keeping girls in school, social protection for poor families, and engagement with religious and village leaders. Programs that offer cash transport, safe transport to secondary school, and life skills clubs give families real alternatives to early marriage. Monitoring must track reports, prosecutions, and service access for married adolescents, like antenatal care, contraception, or protection services to close the enforcement gap. Finally, centering girls' voices and working with boys and men shifts harmful norms over time, turning policy gains into everyday changes. Gender equality has emerged as a central theme in global advocacy for RCH. Linking reproductive health to women's empowerment strengthens the argument for investment. Campaigns challenge harmful norms such as restrictions on women's mobility or denial of contraceptive access. Ensuring equal access to services for women and girls remains an ethical imperative worldwide. International NGOs play critical roles in global RCH advocacy. They amplify community voices on international platforms, influence global policy debates, and provide both technical expertise and funding. NGOs like Save the Children and CARE have shaped child health and reproductive rights campaigns across continents, bridging grassroots struggles with global agendas. Global networks, like we have several times discussed about White Ribbon Alliance or International Planned Parenthood Federation and the Global Financing Facility, demonstrate how collective action influences RCH. These networks unite actors from multiple countries, poor resources, and advocate for policies that prioritize women and children's health. Their reach magnifies national and local advocacy efforts. Global advocacy faces ethical challenges. Advocates must balance universal rights with respect for cultural contexts, avoiding a top down imposition of norms. Representation of local voices is essential to avoid tokenism or paternalism. Ethical global advocacy respects diversity while affirming universal principles of justice and dignity. Global health governance shapes RCH advocacy. UN agencies coordinate standards and commitments while global funding mechanisms like Gavi or the Global Fund influence priorities. However, alignment with national sovereignty is critical. Countries must retain ownership of their health systems. Effective global advocacy respects this balance. Digital advocacy has revolutionized global RCH movements. Campaigns like Me Too or Girls Not Brides mobilized voices across borders, raising awareness and demanding change. Social media enables rapid mobilization but also carries risks of misinformation or superficial engagement. Advocates must harness digital tools responsibly to maximize impact. Global advocacy often reflects dynamics between the global north and south. Power imbalances in funding can skew priorities, creating donor driven agendas. To address this, equitable partnerships are essential, ensuring that Southern voices lead on issues affecting their populations. True global advocacy is collaborative and respectful. In humanitarian settings, conflicts, natural disasters, or refugee crises, advocacy for RCH becomes urgent. Maternal and child health services often collapse, leaving populations vulnerable. Advocacy highlights the need for continuity of care, protection of rights, and inclusion of reproductive health in humanitarian response frameworks. Equity is the heart of global advocacy. Campaigns emphasize reducing disparities across regions, income groups, and genders. Marginalized groups, indigenous people, rural communities, urban poor are often prioritized. The global commitment of Leave No One Behind under the Sustainable Development Goals provides an ethical anchor for equity focused advocacy. In practice, this means disaggregating data by gender, wealth, caste, tribe, and location to see who's being left out and then targeting resources to those gaps. Bring services closer, mobile clinics, transport vouchers, and community health workers, and design them with local leaders so care is culturally safe. Track progress on simple dashboards and share updates with communities. Budget protections keep equity actions going even when resources are tight. Measuring of global advocacy impact involves tracking policy changes, funding commitments, and health outcomes. For example, the increase in global funding for immunization reflects successful advocacy. Declines in child mortality worldwide also signals the effectiveness of advocacy movements. Measuring impact ensures accountability and guides future strategies. Add simple metrics and routines. List each advocacy ask, the decision maker, and the status on a small dashboard. Track the money which was pledged versus the money which was actually disbursed, and link it to the outcomes like vaccine coverage or maternal deaths averted. Use equity lenses. See whether gains reached rural areas, the poorest quantiles, and minority groups, including the marginalized vulnerable populations. Combine numbers with short case stories from countries or districts to show how policy shifts changed real lives. Review these indicators quarterly and adjust advocacy messages and partners based on what is working and where the gaps are still remaining. Emerging global issues are reshaping RCH advocacy. Climate change affects maternal and child health through food insecurity and extreme weather. Migration raises challenges of cross border access to care. Technological innovations from digital health to artificial intelligence present both opportunities and ethical questions. Global advocacy must adapt to these evolving issues. We should push for climate resilient health services like safe water, heat ready facilities, and emergency transport plans for floods or storms. Migrant friendly policies are needed, including portable health records, language support, and care without fear of deportation. For digital tools and AI, insist on strong privacy protections, clear consent, and audits to prevent bias. So technology helps everyone, not just the connected. Finally, link these agendas to funding and global partnerships and track progress with simple equity indicators to ensure the poorest families benefit first. Academia contributes by generating research evidence, training future advocates, and offering neutral platforms for dialogue. Universities and research centers strengthen advocacy by providing credible evidence based inputs and nurturing the next generation of professionals who can combine scholarship with activism. Future global advocacy will see stronger South South collaborations with countries in Africa, Asia, and Latin America learning from each other. Gender and equality lenses will be integrated into all programs. Youth driven movements will take care to take the center stage, using digital tools and grassroots organizing to redefine the advocacy landscape. Expect practical exchanges, toolkits, dashboards, and peer visits that help countries adapt what already works instead of starting from scratch. Every proposed will include equity checks and budgets to reach the poorest, rural migrant and minority groups. Young advocates will lead with short, clear messages, social media campaigns, and community action, keeping leaders accountable with simple updates. Together, these shifts will make global advocacy faster, fairer, and closer to real community needs. To summarize, global frameworks like the CRC and CDAW set ethical standards for RCH. Advocacy movements such as ICPD and Every Woman, Every Child have reshaped priorities worldwide. Yet, global advocacy must balance universal rights with cultural context, ensuring inclusivity and authentic representation. In conclusion, global perspectives remind us that reproductive and child health rights are not privileges granted by some states for universal rights guaranteed to all. Advocacy ensures that these rights are implemented, monitored, and defended worldwide. By learning from global experiences, we strengthen our local and national efforts. As we close today, reflect on the idea that health is a global responsibility. Advocacy ensures that no child or mother, regardless of where they were born, is left behind. This requires international solidarity, ethical commitment, and collective action that transcends borders. This concludes Lecture 59, where we explored global perspectives on RCH ethics and advocacy. In our next lecture, we will discuss ethical leadership in RCH advocacy and policy, focusing on the values, vision, and accountability needed to guide advocacy at all levels. Thank you for today.